My name is Angela Gibson. I'm the Surgical Services Manager for the perioperative services. I've been a nurse since 1998. I started off on the floor as an inpatient nurse, and I worked there for about 7 years, and then I came to surgery where I was a circulating nurse, and I also scrubbed cases. And then recently I became a charge nurse, just doing the daily activities for the surgery desk. And within the last month, I became the surgical services manager. I've always known that I wanted to be a nurse since I was 9 years old. It relates back to seeing my grandfather in a hospital when I was younger. Being around the healthcare setting, I had a cousin that was a nurse. It really interested me. So probably, like I said, since I was 9, I've always wanted to be a nurse. And I loved it. I went to school at Wright State University in Dayton, and I received my bachelor's degree. And I then went on to have, my license as an RN, and then I automatically started working here at Joint Township. So I've always worked at Joint Township, whether it's been on the floor or in surgery. I enjoy what I do. I'm in a new role now as a manager, but I do enjoy going back to the rooms and helping and just doing all aspects of the surgical services.
I'm Sarah Martin. I'm a certified surgical technologist. I've been a technologist for 3 years now. I've been at Joint Township for 1.5 years, almost 2. And I picked being a CST because I wanted to help people, but I didn't necessarily want all the nursing aspect of it. And I decided I wanted to be a scrub tech by chance, actually, because I wanted to be an x-ray tech and work in surgery and just do surgical x-ray all day. But when I was in that program, I decided that that's not what was right for me, and I found a different school that had the program that worked best for me and what was best for my education as well. I went to Brown Mackey in Findlay, and that took about 2 years for me to complete, and I have an associate's degree in it. And I decided that I wanted to be in the medical field because I've always found an interest in that, and I really loved anatomy and physiology when I was in high school. And I just like seeing how the body works, and I just have so much respect for doctors and nurses, and it was the perfect career.
So a typical day in surgical services for an RN, which I am, is we start off about 6:30, 6:45 in the morning, and we work usually until 3:15, but we have someone on call 24 hours a day, and there's 3 of us on call. So if you think about it, basically half of your month is dedicated to call. So there is a lot of call that is in this job. Call is any time during the night a surgeon wants to add on a case. Usually it's an emergent case. We come in with an anesthesia provider and we do the procedure to help that patient out. It can't wait till the next day. It could be a delivery of a baby by cesarean section. It could be an appendix that needs to come out. It could be someone swallowed something and it's stuck. It could be a numerous amounts of different cases, but it's something that can't wait till the next day. So again, the usual day is 6:45 to 3:15. We do cases all day long, and we start, and the cases usually last between a half hour to an hour. Some cases can last longer; they can last 3 to 4 hours, but the majority of our cases are, pretty fast. They go half hour to hour. They do get breaks. Some days there aren't any breaks. Usually they're, everybody's glad if we can get them out for lunch. So usually about a half hour lunch, but a lot of their time is call. So when you go into surgical services, there's usually always an aspect of call, unless you're doing like an outpatient center, and those are even sometimes working on Saturdays too. So healthcare is weekends, it's nights, but it's very rewarding. You're helping someone that needs help at that time. So, you got to be in it for the right reasons. And I've always felt like I'm in it for the right reasons. I always wanted to help patients. And the one thing I really loved about surgery, coming from the floor, working with patients on the floor, was I could only do one surgery at a time. So I can't be in this room, this room, and this room, where on the floor you're kind of getting pulled all in different directions. In surgery, you have to start and finish a case before you can start another one, because there's only that one surgeon. So that was always nice. I felt like I completed a task. When I came to surgery, you complete one task, you move on to the next task.
For a scrub, we have the same hours as the nurses. We usually come in 6:30, 6:45. At this hospital particularly, we work about 8 to 10 hour shifts. I've been at other hospitals where you can work up to 12-hour shifts, and it varies from hospital to hospital and depending on what level trauma center they are too. We, as scrubs, we have different responsibilities than the nurses, and the fact that we don't have all the charting and all that to do, but we pull cases, we set up our rooms, make sure things are ready. We have a preference card that the surgeons tells her like what they like and just any tips and tricks so everything goes as smooth as possible. And we're there also to assist the RN if there's more than one person in the room. You want to help out, you want to be as a team. And the call can be brutal from time to time, but it's very rewarding to help people at night. And like Angie said, with this, we can be in C-sections, we can be doing bowel cases, and there's no time that a surgery there always have to be done.
So the skills that are needed most, I think, in surgery, once you get out of your schooling, but just to get through schooling, is dedication, hard work, and definitely there's times where you're like, why am I in this? But always remember that at the end, there is a big payoff, and the payoff is just within yourself to know that you're helping people and you're making a living doing it. And healthcare is never going to go away, especially surgery. It's very it's not going anywhere. Our job is very stable, just for the fact that people will always need to have surgical procedures. As usually most of them are going more as outpatients, but what I mean by that is they come in, they have their procedure done, and they go home the same day. A lot of them aren't staying in the hospitals anymore. But getting back to skills, once you're out, confidence is huge. Confidence in yourself and relaying that to your team members that you're confident in what you do, and even if you have questions, you're still confident in asking those questions. And then also being open to constructive criticism, because the doctor is the leader and he wants it usually a certain way, and that's good. He needs to be confident in you, he needs to be confident in himself. So always being open to learning new ways, learning a different way of doing a procedure, or assisting, or just learning their way of doing how they like things done. So open communication is huge. Being able to speak in a professional manner, just being open, definitely open to change. You also want to always remember, that could be your loved one that you're doing a procedure on. That's what always helped me. So I imagine my mother or my grandmother or my sister as the patient, so that I want the best for that patient. And I think that's what helps me, and I think it does. I've heard it all throughout surgical services where we work, that is what makes us do the best job we can, because we imagine that being our family member. So one of the things that, looking back, I wish I would have done in high school and in college, and it wasn't offered at the time, was take Latin. And everybody looks down on Latin probably because it's hard, but Latin has a lot to do with the medical field, and so a lot of your medical terminology comes from Latin. And so I think it would have helped me with anatomy and physiology and just all those nursing courses, having that background in Latin. Years ago, Latin was offered, and I think it might have been offered, but I took French. Don't ask me why. It didn't help me at all. So, but I think taking those, taking seriously your health classes, your science classes, chemistry is really important to get through the nursing program. Chemistry, anatomy and physiology, your A&P, or your psych and soc, those sociology, psychology, those classes are heavy, and especially in mine for the bachelor's program for the RN. Some nurses just have a 2-year associate degree. Some of them have a 4-year degree. I have the 4-year bachelor's, but anymore, a lot of the nursing programs are looking more towards bachelor's nursing. That's just what they're hiring. Not to say that you can't have an associate's and maybe go to work for someone, and then sometimes that hospital or facility will pay for you to go back and get your bachelor's. But just knowing those courses, I didn't think chemistry was real important in high school until I went to college and realized that I was not prepared. So it took a lot of studying on my part. So yeah, just those science courses are very important.
I would also agree that the science and health and anatomy and physiology classes are really important. Also, I do research of what you're wanting to major in. Like my previous major, I needed to know a lot of things about physics, and I didn't take physics in high school because it was a college credit, and I was taking 3 college classes already, and I didn't want to overwhelm myself. And when I got to physics in college, it was severely overwhelming, and you can push through it, but it's difficult. So, maybe do some research and see if there's classes you can take through your high school, whether it's a college credit or if it's, for your own benefit. But definitely research that and just take things seriously, learn the best that you can. And like Angie's referred, anatomy and physiology is important. I wish I would have taken it a little bit more seriously in high school, and because I think it would have made when I took it in college a little bit easier, but I had a lot of things with college classes already being in high school, and medical terminology is a big thing, and I took that in high school as well, and I think that really benefited me learning that, and I could apply it to my anatomy and physiology classes when I got to that point.
What I enjoy most about my job is working with people, whether it be the staff members or the doctors or the anesthesiologist or just the patients. Most of all, it really is the patients. And as a manager, I don't get as much of the patient interaction, and that is one part that I miss. But I've always, I feel like we work well as a team. The OR has to work as a team or it'll just fall apart. We do things that we don't even realize without talking. It's just kind of like I don't want to say an assembly line, but everybody in the room has a job to do, and we all know how to do it. But yet we still communicate at the same time. So it's really important to work as a team, and I think that's what I always thought was amazing when I came to surgery, is that all these little pieces come together to help a patient. So I think that's my favorite thing, and to actually, in surgery, you're fixing things. Now, not always do we get a positive outcome, but for the most part, patients that come in for an outpatient basis, we do get really good outcomes. And so I think that's what I really like, is the end result is usually a good one for the patient.
What I like most about my job is I love the teamwork aspect of it, and the fact that we spend all 8-10 hours plus call together. You become like a family, because sometimes you spend more time with them than you do with your own family from time to time, and you work together, you try to make the best for the patient. I like that it's made me a more confident person, because I've always struggled with confidence, but with my program and then being other places, and especially here the most, that I've been able to become a more confident person in my job. And I like that we can make things better for our patients, and that you get to see how the body works, you get to see how the muscles and the tendons and just anything, and there's so much technology out there that things have changed even in the short period that I've been a tech, all the different gadgets that have come out. It's really interesting to see how we can make things better this way, and how things are continuously changing in our field. But I love the aspect of the teamwork, and I like the aspect of just helping people in general. And it's a different way of helping people than from a nurse's perspective, where they're with the patient all the time, where we don't necessarily always get to talk to the patient. That's kind of the difficult part of our job, that you don't have that connection, but in a long run that you made that difference.